valuable yellowing ancient map, which symbolizes a significant part of historical Subic Bay, Philippines, was formerly the site of a major U.S. Navy facility strategically positioned in global history. A new landmark of Subic Bay, an endless sea view, a clear and bright light from the sky. Honorable and luxurious Triboa Bay Country Club. MSK Group enhanced the gorgeous architectural design to attain Subic Bay's glorious history. Triboa Majestic Bay. For a great change in the coming century. Big outbreak of Southeast Asian economy, Subic Bay, Philippines is undergoing a breathtaking change. The Philippines has the fastest economic growth and is a major member of ASEAN. In recent years, the ASEAN economy has grown by leaps and bounds, not only actively negotiating FTA with other countries, but also established the ASEAN Economic Community in 2015. Subic is positioned close to Manila, capital of the Philippines. Superhighways, MRT networks, and other major new traffic construction plans across the suburbs of the city, mountains, and seas surrounding Subic Bay. Full of tropical jungle views and romantic ocean atmosphere, Subic Bay embraces nature with water sport activities coinciding with a safe and secure environment, which attracts multinational companies to invest and bring unlimited development potential. Emerging properties for investment. Subic Bay area is the biggest free-port zone in the Philippines. There are more than 1,500 domestic and foreign investors. Accumulated investment amount is more than $9.1 billion US. Well-developed transportation network of land, sea, and air. Subic Bay Special Economic Zone also has tourist attractions, duty-free shopping malls, world-class international schools, and much more. Subic Bay is the best investment destination. Discover the hidden gold of Subic. Triboa Majestic Bay, built along the landscape. Designed with superb masterpieces and splendor. Discover the hidden gold of Subic. Embrace the endless treasure of Subic. Baroque architecture, full of the romantic essence of Europe. Rich as nature. A noble piece of art, retaining an appropriately peaceful imagination. Your artistic grace, giving your soul peace and tranquility. Comparable to a 7-star hotel's public utilities. Embrace the mountain and the seas. Cherish the wonders of the sun and moon. Inherit the legacy of natural bounties. Upgrade to the ultimate. Embrace the art. Push your quality of life to the highest. 5,000 square meter English-style atrium garden. The wind blew hard and the sea was billowing. Lights and shadows flowing light up the heart's true temperament. D-Tide reflects the moonlight and chains it to a priceless treasure. It's a home for those who desire the great life of treasure. To the perfect lifestyle feast, the MSK Group will provide a brilliant architectural landscape for a new history in the making. The scenic blue sky of Subic Bay that plays wonderful memories. Expect to build a new life and open the door to a new life vision. The blue sky and water flows like an unchained melody of love. The sea glinting in the sunbeams calms your mind in peacefulness. MSK Group, Triboa Majestic Bay.
nating si Celia. May peace of mind na siya. May investment na. Future prepared pa. Ano nga bang iniisip ng tao kapag narinig o sinabing memorya na? Nakaka-curious, no? Sige nga, alamin natin. Siya ang una nating extra. Let's see kung ano maging reaction ni Kuya. Naku, mukhang close-minded pa siya. At siya naman ang pangalawa nating extra. Tignan naman natin kung anong nasa isip ni ate. Ay, mukhang na-stress si ate nang maisip ang mga bayarin at priorities niya. At ito na, ang ating bida. Si Celia, ang babaeng laging advance mag-isip. Tulad ng 90% na mga buyers ng Eternal Gardens, advance din naisip ni Celia ang kahalagaan ng pre-need planning. Mas mahirap kasi at mas mahal kung bibili ka pag dumating na yung di mo inaasahan. At ito ang isa sa pinakamagandang hindi alam ng iba. It's a form of investment. Dahil tumataas ang value nito, pwede mong ibenta. Wise decision, di ba? Kaya tularan natin si Celia. May peace of mind na siya. May investment na. Future prepared pa.
Okay, good morning and welcome to Business Mirror's Coffee Club, where we discuss the latest and hottest news items. I am your host, Anne Ruth de la Cruz, the Special Projects Editor of Business Mirror. Joining me as my co host for this morning's discussion is the man who helped me put this together, Mike Policarpio, the Envoys and Expats Editor of Business Mirror. Good morning, Mike.
Good morning. Thank you, Anne, and pleasant morning to everyone. We have a special edition of our coffee club this morning with the theme Global Practices Against the COVID-19 Pandemic. We will have with us two ambassadors who will share the country's experiences in tackling the global health crisis. So, Anne, please do the honor of introducing our first guest.
Our first guest was the Deputy Head of Mission and Consul General at the New Zealand Embassy in Tokyo from February 2015 to April 2019 and Acting Ambassador from April to July 2019. Before that, he served in Wellington for 5 years in the Human Resources Division and Chief Executive's Office before undertaking a secondment to the office of the Minister of Foreign Affairs. His last role in Wellington was as principal advisor to the Deputy Secretary of the Americas and Asia Group. He also served in Oniara, London, and twice before in Tokyo. He is a graduate of Kyoto University and Victoria University of Wellington. Before taking up his assignment in Manila, he spent 3 months in intensive Filipino language training. Please welcome His Excellency Peter Kell, the New Zealand Ambassador to the Philippines.
Good morning, and thank you very much for that introduction. Kia ora tātou katoa. A big, warm, cheery hello from New Zealand and New Zealanders to all our listeners. And I acknowledge my fellow panelists, Representative Michael Peiyung Su of the Taipei Economic and Cultural Office. Ako si Peter Kell, Ambassador na New Zealand.
Ambassador Kell.
Yes. Hello.
Good morning.
Good morning. Can you hear me?
Okay, na. Okay, good morning, Ambassador Kell.
Good morning. Can you hear me okay?
Yes, we can.
Ah, fantastic.
Loud and clear, sir.
Okay, well, let me start
I
again.
can't
yeah.
hear him. I don't know why. Let's introduce our second guest first, and we'll call back Ambassador Kell later.
Okay, thank you.
Oh, there you are.
Oh, you
Hi,
hear me now?
Ambassador. Good morning. Yes.
Good morning. Sorry about that.
Yes.
A
Yes, that's
big,
okay.
A big kia ora tātou from New Zealand and New Zealanders to all our listeners. And I'd like to acknowledge my fellow panelist, the representative Michael Peiyung Su of the Taipei Economic and Cultural Office. Ako si Peter Kell, Ambassador na New Zealand dito sa Pilipinas. Maraming salamat sa itong pagkakataong magsalita ng karanasan ng New Zealand. Can I start by first, though, acknowledging the impacts of COVID in the Philippines? We know that Filipino families and their communities continue to feel the devastating health impacts of the pandemic. My sympathies are with those people and with the people who have lost loved ones to this virus here in the Philippines and also around the world. I want to also strongly acknowledge the Philippines' COVID response and the tireless efforts of the Philippine government, local governments, frontline healthcare workers, and others who are working to keep people and communities in the Philippines safe. So New Zealand, where do we stand at the moment? As of yesterday, New Zealand has had 18 active cases, 18 cases of COVID-19, and all of those cases are managed at our border. To put that into perspective, our first case in New Zealand was reported on the 28th of February. Since then, we've had a total, as of yesterday, 2,644 cases, 2,644 cases. 2,288 are confirmed and 356 probable. And we've had 26 deaths. Our cases peaked early April last year, where we had 89 cases recorded per day. And at one point, we had 929 active cases. As of the 22nd of March this year, we've had a total of around 1.8 million COVID tests done, which is roughly a third of our population. So from that position last year, we now arrive at a position as of yesterday where we have 18 cases of COVID managed at our border. This time last year, though, how were we doing 12 months ago from now? So we were just entering May. We were in a pretty good place. We'd just finished a month-long strict lockdown as part of our go hard and go early strategy. We were just beginning to start our streak of what turned out to be 0 cases. We had a few isolated cases of community transmission, but we had managed to manage those through early regionalized lockdowns. We continue, however, to take a cautious and prudent approach, and we remain vigilant against a potential next wave of outbreaks. In New Zealand, we introduced a four-level alert system. Level 4 is the most strict, and level 1 is, in effect, life as normal. Today, New Zealand is at alert level 1, and for most New Zealanders, life is pretty much as it was pre-COVID. Any cases that we have tend to be managed at our quarantine facilities, and they tend to come from those who have arrived in New Zealand from overseas. As part of their quarantine procedure, they're expected to spend 14 days in a facility, and that's typically where we catch those COVID cases. As I'm sure most of you know, New Zealand's borders are closed to most travellers, and we continue to maintain strict controls for those who are able to return to New Zealand. And we've also begun travel bubbles with countries that have successfully managed their cases, countries such as Australia, and we will soon include the Cook Islands this month. Now, some of you are probably wondering, so how do we get there? Let me just touch on a few points. The first is that our response was science-based. We believe our response has been effective because it is grounded in the health advice of scientists and health professionals. Another key aspect of our approach is that our Prime Minister and her government early on decided on not only the approach to take, but also on how to communicate that approach. And so communication to ensure all New Zealanders got behind the government response was really, really important. Some of you may have heard of our Prime Minister talk about the team of 5 million. That's the population of New Zealand. This communication approach helped to galvanize New Zealanders and to get behind the government's COVID response. And so the response became, in effect, a collective community effort to unite against COVID-19. And I can recall very early on in those days how our Prime Minister used to tell her fellow New Zealanders that this is a tough time for all, but be kind, be compassionate, be understanding. In New Zealand, we have a Māori proverb, whakatauki, and it goes like this: he waka eka noa, which means we are all in this together. And I think truly part of the effective response of New Zealand has been the way the whole community has been able to get together behind the government. New Zealand, most of you will know where we are. We're a very small country located at the bottom of the world. Even though we're only 5 million, we're a diverse bunch. We're a country in and of the Asia Pacific. We draw from our strong indigenous Māori culture, our close Pacifica, social and cultural connections, and we are enriched by the contributions of migrants across the region and beyond who have chosen to make New Zealand their home. And indeed, we are privileged to have a growing, vibrant Filipino community. By some figures, we have over 70,000 from the Philippines who consider New Zealand their home. In this way, the diversity of our culture and our values has combined to form the backbone of New Zealand society today. And I believe that it's that resilience that we draw from our diversity that's also helped our country get through the COVID response. Just to finish off very quickly, what are some of the specific measures that we took? Well, as I said, we decided to go hard and go early because modeling at the time suggested that we were facing a crisis if we didn't take action quickly. And the crisis for us, as I'm sure you well know, is that our public health system would not be able to cope with the number of cases. The actions we took include closing the borders, requiring people to isolate, particularly those returning from overseas. We put in place an alert system. We placed our country under the strictest level of that alert system for a month or two until we had comparatively low confirmed cases of COVID-19. We implement localized lockdowns and we do widespread testing, including genome sequencing. As I said before, our response is based on science, and as the science on COVID evolves, so do our responses in New Zealand. People will often ask me, so what would you recommend to the Philippine government, the Philippine people, based on your experience in New Zealand? And to be honest, humbly, I'm not an expert, and I'm really in no position to tell another government or indeed its people how to manage their situation, because they will know best. But what I can do is talk about how we managed ours in the hope that some of our lessons can be useful. And I would probably say that health science-based approach, is extremely important, particularly as the virus evolves. I think that it's also important to recognize that each country is different and there is no one solution. Each country has to develop its own solution. And in the case of New Zealand, we had options that other countries, did not. We were lucky to be a small population. We're an island nation. We got the virus relatively late in New Zealand. We were able to see how other countries and economies, such as Taipei, Taiwan, had coped with the virus. And we were able to factor that into our own policy response. And we continue to do that. We share our lessons and we learn from others as we all together grapple with the virus in its many variant forms. I'm going to stop there. I think I've spoken at you enough, and I'd be very happy to take questions. Maraming salamat po. Tēnā koutou, tēnā koutou, tēnā koutou katoa.
Thank you so much, Ambassador Kell. Before Mike introduces the representative from Taipei, here are some shout-outs. Shout-outs to Tin Suarez Jocos, Nika Julianda, Ana Casabuena, Larry Fernandez, Aldwin Tolosa, Rodel Suarez, Philip Navarro, Maynard Moises, and Edwin Salyan. And also to Eunice Calma from Filipino Mirror. Thank you for joining us. Go ahead, Mike.
Yes, thanks, Anne. Now, before we proceed to introducing our next guest, I believe some very key takeaways from what Ambassador Kell mentioned. So, I guess the most prominent would be that humanity factor wasn't lost in their approach to addressing the COVID-19 situation in their country, even though it was very science-based with their approach. So very well said, Ambassador Kell, and we'll be hearing from you later. All right, for our second guest, the Business Mirror had the privilege of interviewing him in 2018 for the Diplomat's Profile of the Envoys and Expat section. Among the positions he held for Taiwan were Director General for the Department of International Organizations of the Ministry of Foreign Affairs, and concurrently as APEC Senior Official, Representative of the Taipei Liaison Office in the Republic of South Korea, Deputy Representative of the Taipei Economic and Cultural Office in the Philippines, and Deputy Director General of the Department of North American Affairs at Taiwan's Ministry of Foreign Affairs. He is a graduate of the National Cheng University, I hope I said it right, with a degree in diplomacy and the Master of Arts in China Studies. He also studied at the Ottawa University in Canada and the Senior Fellows Program at Harvard University. We are pleased to have with us Representative Michael Peiyung of the Taipei Economic and Cultural Office. Welcome, Representative Su, and may we hear from you now.
Thank you, Mr. Michael Policarpio and Ms. Anne de la Cruz. His Excellency Ambassador Peter Kell. Ladies and gentlemen, good morning. 早安, magandang umaga sa inyong lahat. First, I would like to say thank you to the BusinessMirror, a leading business newspaper in the Philippines, for inviting me to attend the BM Coffee Club webinar. I am pleased to share Taiwan's story in the fight against COVID-19 pandemic. I'm glad to have the opportunity to learn from Ambassador Kell through this webinar. I look forward to our conversation later on about the success story of New Zealand in containing the COVID-19 pandemic. Let me update you the current situation in Taiwan. As of May 12, 2021, Taiwan has recorded 1,231 confirmed cases. Around 86% of these cases were imported. The recovery rate was nearly 90%, with 122 patients were still hospitalized and 12 patients passed away. A few days ago, we just experienced a surge of indigenous cases, which now are under rigorous contact tracing and source investigation. My government looks at this situation very seriously. Therefore, we raised the epidemic warning to level 2 and implemented more restrictions. Now, indoor activities, the number of people cannot exceed 100, and outdoor cannot exceed 500. The COVID-19 pandemic has a profound global impact, and Taiwan is no exception. Last year, thanks to Taiwan's robust health system, rigorous testing strategies, information transparency, and public-private partnerships, we were able to contain the spread of the COVID-19 pandemic. We did not impose lockdown. Our people enjoyed relatively normal lives. People went to work, students went to school, and professional baseball games were played. We enjoyed a 3.1% of GDP growth, while many countries suffered. This year, we continue the anti-pandemic measures and closely watch the pandemic situation at home and abroad. We also work on vaccination. Apart from importing vaccines, we develop our own. We expect 2 local companies, Medigen and United Biomedical, to begin mass production as early as this late July. In the future, if there is surplus, we would be happy to share vaccines with other countries, including the Philippines. I sincerely hope that Taiwan's practice could also be helpful to our Filipino brothers and sisters. I do hope the COVID-19 pandemic here in the Philippines could soon be mitigated. This is a brief introduction of the situation in Taiwan, and I look forward to our conversation. Thank you. Maraming salamat po at mabuhay.
Thank you so much, Representative Su. So let's start the discussion. Ambassador Kell, I was interested about you were talking about the New Zealand government depended on the science approach to dealing with the COVID-19 situation. What was the composition of the team, of the government team that handled the situation?
Thank you for the question, Anne Ruth. So the government's first response really was to pull together a national task force responsible for the response to COVID. That included a number of health professionals from our universities. They were coordinating closely with colleagues around the world. And as I understand it, it was really some modeling that had been done in the United Kingdom, and the results had been released late February, no, early March, that decided our government to change its proposed strategy from being one of suppression, in effect, how we normally respond to a common flu or a pandemic, to elimination. Because they recognized that the modeling suggested that if they did not take a more aggressive approach, then our public health system would be overrun. And so that was how they organized the input of health professionals and other officials involved in the initial response.
Okay. And you also emphasized earlier that the importance of communication. How did you do it? How did the government carry out this strategy?
Yeah, so in effect, our Prime Minister, together with the Director General responsible for health, became the face of the government's response. In effect, our Prime Minister was the lead person, supported by the senior official responsible for the public health response. And so she had a continuous, deliberate, clear and certain strategy around communicating to all New Zealanders to ensure that they knew what the government was doing and the reasons for that. And I think that was a large reason why in the early days many New Zealanders felt less anxious and more willing to undertake some of those, which for New Zealanders are drastic measures. We've never really done that sort of thing in New Zealand. And it's very hard in many ways for New Zealanders to accept those kinds of measures. But we did, and we continue to. And that's how the government approached communication. It was really from the highest person in our government, the Prime Minister, supported by the senior official responsible for the health response.
Thank you so much, Ambassador Kell. Can I ask you the same question, Representative Su? What was the composition of the government team that handled the COVID-19 situation in Taiwan?
Thank you for asking this question. I would like to say a key factor of Taiwan's success story in the fight against COVID-19 is an efficient and determined leader, Her Excellency President Tsai Ing-wen, and the solidarity among our people. We also use health technology to do the contact tracing, and since last year, when we activated our Central Epidemic Command Center on January 20, 2020, we had a daily briefing, and if there is a need, we even had 2 briefings daily to help our people well informed of the situation of the pandemic at home and around the world. And so because of the transparency, because of a good communication, our people work together with the government. So that's why I mentioned solidarity is so important. My country handled this COVID-19 pandemic as a national security issue from the beginning. And President Tsai Ing-wen convened a National Security Council meeting even in the beginning of this pandemic. And yesterday, because of the recent surge of the confirmed cases, President Tsai summoned another National Security Council meeting. So my government, not only use health tech to do the contact tracing, not only keep our people well informed and by the daily briefing, and also we stick to the transparency. And I think transparency and the people's trust plus technology. These three elements contribute to the containment of COVID-19 pandemic in Taiwan.
Thank you so much, Representative Su. I'd like to acknowledge Eunice Calma. She is one of our writers from our sister publication, Filipino Mirror. Good morning, Eunice. You have any questions for our guests?
Good morning po. Yes, good morning. None so far.
Okay. Just let us know if you have any questions.
Yes, I will. Thank you.
Okay. Thank you so much. Representative Su, I'm interested in how you did your contact tracing in Taiwan. Did you do it online, or did you employ people to do your contact tracing? How is it done in Taiwan?
We do the contact tracing in Taiwan. We use apps
You use apps.
in mobile phone. We use apps.
Okay.
We also use the so-called electronic fence to monitor the movement of the whereabout of the confirmed cases. And because if you hire people to do the contact tracing, it's not so efficient. So that's why we use the apps. And all the people in Taiwan download these apps in their cell phone. So that's why I mentioned high tech is very important to do the contact tracing. Even in the recent search, now we could monitor all the people who have contacted the confirmed cases. But we are trying our best to identify the orange of the confirmed cases, in the recent search. So we use the electronic, device to do the contact tracing, not using manpower. For example, if a person who is under monitor leave his or her residence without a permission, these apps will inform the police and the barangay captain, and and also a health official, so they could know these people now is not abide by the protocols of quarantine. So that's how we do it and how we did it.
Okay, thank you, Representative Su. Ambassador Kell, do you have a similar situation also in New Zealand? Do you also do contact tracing, and how is it done there?
Yes, no, look, we certainly do contact tracing. It's nowhere near as high tech as what seems to be the case, according to our fellow colleague, Rep. Michael. Ours is probably closer to the old-fashioned way. We don't use technology in quite the same way. And I think that probably, as I understand it, talking to some of the professionals involved, because there's a kind of a cultural mindset dimension to how people do things and how people gather information. And at the end of the day, from what I understand, regardless of the technology that's used, you need people to analyze, gather. And so we tend to use people to follow up, whether it be by telephone or what have you. And it's quite a labor-intensive process in New Zealand. And I think it just reflects, our starting position in terms of how we employ technology for this kind of situation. We probably haven't done it in quite the way that other countries have and are more comfortable using technology and have infrastructure, so to speak, and people are used to that. So for us, that's actually one of the areas we're still working hard on to up our game, and it's evolving as we speak.
Ambassador Kell, can you tell us about how is the healthcare system in New Zealand? Is do you have government subsidies? How is it there?
Oh, I see what you mean. Yes, so basically we have government care, and then you also have private care. All New Zealand, actually anyone who's in New Zealand can access the public health system free of charge. But of course, as you can imagine, then there are waiting lists and queues. And so for those who wish to get care more quickly, you can also go through private health insurance schemes. And really it was, I suppose it was looking at the public health system. If we suddenly had a surge in COVID cases, the government recognized that it wouldn't be able to cope.
Okay. So at least you did well. You did very well because your healthcare system was not tested as it is here in the Philippines currently.
Exactly.
Mhm.
In some parts of New Zealand, it was tested, but
Mhm.
not in the way that we've seen here or in other countries. And
Mhm.
that was part of the reason why our government decided really to switch its strategy, because it wished to try and avoid that situation. And
Mhm.
that was based on the science that it was seeing coming out of the UK.
Okay. Thank you, Ambassador Kim. Representative Su, can you tell us more about the healthcare system in Taiwan?
Thank you. Actually, we started implementing the national health insurance system in Taiwan since 1995. So people in Taiwan, they are covered with the national health insurance. And then this time we combine the big data of our national health insurance with the big data of our national immigration agency. So from the database, we can instantly identify cases with a history of travel to affected areas. And I also would like to mention that currently, our medical institutions, the hospitals in Taiwan, the capacity of them to treat the COVID-19 patients is over 10,000. So that means in the meantime we could treat more than 10,000 COVID-19 patients if it is the case in isolation. In Taiwan, we try to designate hospitals who especially have to take care of the COVID-19 patients. Uh, in doing this way, we can protect other patients when they have the need. They can go to some hospital. They feel more comfortable and safe because those hospitals, will not accept the COVID-19 cases. We have, special hospitals, and designated hospitals to treat the COVID-19 cases. And also, we have enough negative pressure rooms. We have around 1,000 such rooms nationwide. And even now,
We want to
those
ask
rooms are
Ma'am
not,
Saiki's
well
question.
used because we don't have, so many confirmed cases. And if, we reach a stage that is more serious, there are 171 hospitals in Taiwan with emergency response capabilities. So adding some 2,400 beds to the total capacity. So patients would still isolated in the one person, one room. So the government has ordered the relevant hospitals to have their special wards in operation within 1 week. So the entire hospitals, they are mobilized since January last year. So for this COVID-19 pandemic, my government has been well prepared. Even I would like to say since 2003, because if you remember, in 2003, Taiwan suffered a lot from the SARS, the severe, acute respiratory syndrome, and so since 2003, we learned a very painful lesson, and then we try to prepare ourselves, and so we mobilize all the medical resources since the start of this COVID-19 pandemic.
Thank you for so much, Ambassador. Hi, Representative Su. I think we have questions from the audience that we'd like to ask you.
Yes, and actually, they're more concerned about the vaccine rollout.
Uh-huh.
So we got this message from our colleague from the Philippines Graphic, Ms. Psyche Ross Mendoza. Probably we could ask the question later as we post our queries from our envoys regarding vaccines. Yes, so we'll
Okay.
get into that later.
Okay. So, do you have any other questions that we can tackle? The healthcare system, the security system.
So just something to chime in, and uh, we have seen this from my takeaway of the two representatives. comments and inputs on their approach to the pandemic. We've seen a contrast in how Taiwan has taken technology.
Yep.
And then New Zealand, as Ambassador Kell revealed, they were very labor intensive in their approach in contact tracing, that is.
Yeah.
But one thing that's common about the two countries is that both of them are being led by females.
Yeah, that's
Yes.
right.
So our
Female power.
Yes. Commendation to the two female leaders. As they said, if you want something said, tell it to a man. If you want something done, tell it to a woman. So very good approach and the way they've handled the pandemic situation in their countries. And so far, they're succeeding in it.
Salamat po, Mike. Oo nga, ganun eh.
Would you like to react to that, Ambassador Kell?
Gosh. I think in the case of our leader, I would say that in many ways she represents New Zealand, and I was talking about the diversity and the inclusiveness, and that's been very much her trait, her characteristic, and I think in a way all New Zealanders support and are proud of the way the government and our Prime Minister, as the head of the government, has led us through this. I think that speaks for itself.
How about you, Representative Su? What can you say about your leader in Taiwan?
I would like to say President Tsai is a very good communicator, and he tried to be very transparent to our people. And so even yesterday, right after the National Security Council meeting, President Tsai had a press briefing, and to make sure that people know, don't panic, and we have enough stockpile of medicine and the mask and all the PPEs. And she also asked our people to work together again with my government, like what we have been doing, since last year. So I think as a very efficient and determined leader, that make our people feel more comfortable and also even safer. Thank you.
All right. We've been getting some more questions in our chat box, Anne. All right. Let me get back to Ms. Psyche Rojas Mendoza's stream of questions. So she says here, in some countries, including the Philippines, politics has come into play in the matter of government handling of the pandemic. So maybe we can get our thoughts from our two envoys. Have you had a similar experience, at least in your countries? Or were you able to prevent politics from coming into play? And how did you do it?
Who would you like to start first, Mike?
Any one of you, since you've already
Okay.
Ambassador Kell.
Yeah,
Please,
look, thank you, Psyche, for the question. It's a good one. When we think of politics, at least in New Zealand, we tend to think of the government in power and the opposition. And I can say that from the outset, the opposition was fully behind the government. And that's because everyone recognized that this wasn't a local issue. It wasn't a regional issue in New Zealand. It wasn't a national issue in New Zealand. It was a global issue. And global solutions require, in a way, bigger thinking on how to solve it. And so I would say that the politics did not come into the response. As the response continues, of course, you start to get more understanding of the issues. You start to have people form views on what the most appropriate way. And for us, of course, in New Zealand, a big issue is the restrictions on travel, our borders being closed. And so the questions are around, well, when do you open them? Because we are a trading nation, whether it's trading our goods from New Zealand overseas or our services, for example, tourism, education, by having people visit us. So we rely on those borders being open. And that's where you will get a spectrum of views, including across the political parties, on when should those borders be opened, how should they be opened. But in terms of the public health response, no, I can say that, you know, all of New Zealand was behind the government in how it handled the COVID response.
Right. Thank you, Ambassador Kell. Now we turn to Representative Su. May we get his thoughts about the question?
Thank you. First, I would like to echo my colleague, Ambassador Peter Kell's statement. I do agree. This COVID-19 pandemic is a global challenge, and also needs a global solution. Back in Taiwan, as I mentioned previously, solidarity is one of the factors which contributed to our success in the fight against COVID-19. In Taiwan, both government and the opposition party work together because we understand that this is a national issue. So no one should be left out. And so people work together, not only the government, even the private sectors. And I can give you some examples, like now in Taiwan, you don't have to remind people of wearing a mask. People, they voluntarily wear a mask every day. Not like here, I learned that even the police have to punish those people who don't wear a mask. So you can see people in Taiwan fully understand the severity of this issue. So all the sectors, government, the private sectors, and the ordinary citizen work together. Even in Taiwan, people do more than what the government asks them to do. The government, only ask them, to do this, then they would do more. For example, for those confirmed cases, I said, during the quarantine, if they violate the restriction, even the neighbors, they would, make a phone call to the health officials to inform them of this case. Another good example is the recent surge of the confirmed cases in Taiwan. Actually, because of the local hospitals doctors, one doctor in Zealand, one in New Taipei City, they were so on alert when they observed, two patients, might be the COVID-19, cases. They informed our Ministry of Health and Welfare immediately and did the test, then confirmed that the two patients actually were the confirmed cases. So you can see the people's awareness of working together contribute a lot to our success.
Okay, thank you, Representative Su. Yes, thank you for your thoughts, sir. Yes, Anne?
No, there was a question here. See Ambassador Kell mentioned earlier that you have 4 levels of declaring. Can you elaborate on that, sir? Because as you know, you've been here in the Philippines, we have different levels of community quarantine. We have MGCQ, MECQ. How was it there in New Zealand?
Yeah, so thank you for the question. It's a good one. Again, I think it comes back to our government's deliberate approach around communication. In a crisis, I think our government, has decided to make its communication clear, concise, and easy to understand. And I think as part of that approach, it decided on a labeling system that people can intuitively understand, even if you don't quite know what each level means. And if you say 1 is normal and 4 is the tightest, strictest environment in which you have to live, most people can kind of understand what the ends of those, two levels might mean, and the bits in between. And that's my personal view on the way the government has approached it. And so in New Zealand, level 4 is the strictest, and that's basically equivalent to, the strictest level here in the Philippines. Level 1 is life is normal. And so in between, you will have various kinds of restrictions on, gathering sizes, who you can meet. In New Zealand, we used very early on the concept of a bubble. So a bubble is usually a household, and within a bubble, you can interact with those people without having to wear masks and that. That's kind of your safe zone. And so by introducing this concept, they were able to say, if you're in level 3, level 4, you can only interact with people in the bubble. Level 3, you can act with one other bubble that's close to you. That they try to make it easy for New Zealanders who aren't used to these restrictions. We very rarely do this. And I think it's really important to understand that, because for people in a place like New Zealand, where life is pretty open and free and you do whatever you want, you don't feel accountable to anyone, it's a real culture shock to suddenly have to stay at home for a month or 5 weeks or 6 weeks. So I think that's been part of the government's approach to the way it labeled our alert system.
Thank you, Ambassador Kell. Representative Su, can you tell us something about that as well in Taiwan? How is the alerts system there?
Thank you very much for asking me this question. In Taiwan, we have only 3 levels, not 4. The first level is just like Ambassador Kell mentioned, people's life is still normal, but you have to keep social distancing, you have to wear a mask. And now we are at the level 2. Level 2, we have the restrictions on the size of gatherings, both indoor and outdoor. I mentioned it in the beginning. So far, at this moment, if you have any indoor gathering, the people's number is limited under 100. Outdoor is 500. If we raise this level to level 3, it will be the strictest level, and it means restaurant and unnecessary institution will be closed, and only the medical institution and the others, even school will be closed. That's the level 3, and so from the beginning of this pandemic, the time now we are experiencing the highest level of alert. That's level 2. Yeah, so we have only 3 levels, and like Ambassador Kell mentioned, every level we have different protocols. People have to follow. And I think the people in Taiwan, they understand the different level and the different restrictions, because the government, once we reach the level, we reached the level to level 2 2 days ago, and people are well informed through the daily briefing by our central epidemic command center.
Thank you, Ambassador Su.
All right, and we've been getting a lot of questions regarding the vaccine rollouts of both countries. So perhaps now's the best time to ask both diplomats about their individual countries' rollout. Now, let me start with Ambassador Su. Now, sir, could you please give us an overview of the vaccine distribution in Taiwan? Your government's plans, as well as your dealings with the COVAX facility and pharmaceutical companies?
Thank you for asking me this question. Taiwan started the COVID-19 vaccination with AstraZeneca vaccine on March 22nd, 2021. According to our Central Epidemic Command Center data, as of May 12, 2021, more than 120,000 people have been inoculated. In other words, an average of around 2,000 people are being vaccinated per day. And the entire vaccination period will run until all the valid doses are used up. For the vaccines, how we get the vaccines? We get the vaccines through two approach. The first one is we get a vaccine directly from the producer. And the other way is we also get vaccine from the COVAX facility. And for example, the AstraZeneca we have received, actually it is from the COVAX facility. And then we also will have, more vaccines. Let me give you the exact number. We already received the COVAX, the AstraZeneca vaccine is about 300,000, and then we are going to have from Pfizer, from Moderna, in this quarter, and also in the third quarter. And we hope to see that we could reach the herd immunity, before the end of this year. And so that's the vaccination program we have so far. Thank you.
All right. You've mentioned about herd immunity being achieved this year, Representative Su. So that's very good news. When we congratulate Taiwan for being able to somehow project that state within the year. Now, just a follow-up question. There has been a spike in the number of cases as of late in Taiwan. So how does that affect the vaccine rollout in your country?
Okay, let me answer this question this way. Because of our success in the containment of COVID-19 pandemic in Taiwan last year, people, they are not very willing to get inoculated. That's why the inoculated people, the number is not very high. But the government is trying very hard to encourage people to get inoculated. And we also have 3 local vaccine manufacturers, and 2 of them are the Medigen Vaccine Biologics Corporation and the United Biomedical Corporation. They are doing very well in producing the vaccine, and they will secure their emergency use authorization from Taiwan's FDA in June and the end of June, respectively. And the mass production will be in July. So the rollout of the local vaccine will start in July. And we'll hope to see that, if we have, surplus of the local vaccines, we could also share with our friends, including the Philippines. So the vaccination program now in Taiwan is getting the momentum, and people understand, to get inoculation is very important. So now we can see every day in the past is less than 10,000 people get inoculated, but now it's more. So people is more aware of inoculation. It's very helpful to their health, especially the protection, from getting confirmed of COVID-19. Thank you.
We'll get back to you with questions later regarding still on the vaccine rollout of Taiwan. Now, let's hear it from New Zealand. Now, Anne, there's a bit of a current contrast between the vaccine rollout between Taiwan and New Zealand, as the latter has taken a rather steady stance in its distribution because of the still low number of cases among New Zealanders. So let us ask Ambassador Kell about that. So basically, Ambassador will be asking the same set of questions, such as the New Zealand government's plan for the vaccination rollout, its dealings with the COVAX facility and pharmaceutical firms, as well as the kinds of vaccines or the brands that are being used in your home country.
Thank you very much, Mike, for those questions. And I was very interested to hear Rep. Michael talk about the experience in Taiwan. So we've been fortunate to observe what other countries and governments have done in the rollout of vaccinations. And the backdrop is that for New Zealand, this is the largest immunization program we've ever done. And so we've been working very hard to put in place a strategy that will make that vaccination program effective and ultimately successful. And that strategy includes, registering and training an additional 2,000 to 3,000 full-time vaccinators, and also purchasing 9 large minus 80-degree freezers to store a total of 1.5 million doses at any time. We're also, looking at what this expansion will mean in terms of making sure that we have a cold chain network throughout our country that will allow the vaccines to be distributed. So we began our vaccination program on the 20th of February this year. From that point on, we have a targeted rollout for about 4 months, where we hope to reach, by the end of it, 2 million people in the at most risk groups. And of course, as I'm sure you and our listeners will understand, we're a population of 5 million, but not everyone can be vaccinated. And so of those that can, and again, of those that choose to be vaccinated, because in New Zealand, it's not mandatory. I have, to be honest, I've heard very little debate in New Zealand over whether people should be vaccinated or not. And I know that that has been a question for some of our listeners about vaccine hesitancy, but I haven't picked up a lot of that in a New Zealand context. We are used to being immunized, but the scale of this one is the biggest ever. So no surprises. We too have a prioritization category, frontline health workers, those most at risk, and those who live and work in places where they're most likely to get COVID. So we prioritize them for vaccination. We're also prioritizing the elderly and anyone with an underlying health condition, and those who live in places where there have been outbreaks. And then those are the priority groups, and they will be vaccinated before the rest of the population up until the beginning of July. And from July onwards, we would then vaccinate the rest of the population. In terms of kind of where we want to be, pretty much like how Rep. Michael has explained, we want to have all of our people who can be vaccinated by the end of the year. That's our target. We too work with COVAX. It aligns with my comments before that global cooperation is important. We've advocated quite strongly for a vaccine to be available to all countries and people. We particularly work with our fellow governments in the Pacific Islands to ensure that they can access a vaccine and to ensure they can deliver immunization programs. We have put in New Zealand dollars 27 million. Gosh, I'm not sure what my conversion is like. Maybe that's like 900 million pesos. I hope I'm right. And as part of our agreement, we have the option to purchase not only successful COVID vaccines for up to 50% of the population of New Zealand, but also for Tokelau, Cook Islands, and Niue. They are part of New Zealand. They are we call them realm territories. What vaccines are we using in New Zealand? We've signed up with several pharmaceutical companies, including Pfizer, Biotech, Janssen Pharmaceutica, AstraZeneca, and Novavax. But New Zealand has chosen to inoculate with the Pfizer vaccine. And we have procured enough vaccines for 2 doses for all who choose to be vaccinated. So how are we tracking? As of last week, 4th of May, we have administered just over 3.8 million doses. And so, sorry, I beg your pardon, 388,000 doses, I beg your pardon. The first dose, those who've got the first dose, number 268,000, just over. And those who have received both doses is about 120,000. So 120,000 people have been fully vaccinated. And as I say before, the plan is to have everybody who can and chooses to be vaccinated, the plan is to have them vaccinated by the end of the year. Thank you.
Okay, so very excellent vaccine rollout from both countries. So if I may, I'll just go through the stream of questions, or at least the vaccine-related questions in our chat. So, gentlemen, has there been any sort of vaccine hesitation among your citizens? This question from our chat room or our comment section. Anything
Perhaps,
of that kind from...
Perhaps I'll leave it to Rep Michael. I think I covered that off in my presentation. I don't pick up anything in New Zealand, but I'd be interested to know what the situation is for you, Representative Michael.
Yes. May I have the question again? Because there's some background noise.
Sure, sir. Any incidences or cases of vaccine hesitancy among the Taiwanese?
Okay, yes. Like I mentioned, we started inoculation on March 22nd. We did have some cases of people, they have the reaction after they got the jab, but it was minor, so nothing serious. So we are now using the AstraZeneca, but we already secured 20 million vaccine contract, including 5 million doses of Moderna, and 10 million doses of AstraZeneca, and 4.7 million doses of unspecified brands through the COVAX facility. So far in Taiwan, people now is be more willing to get inoculation, because the cases of suffering from a reaction because of the vaccination has been not so serious. Yeah, we did have some cases, yeah, but it was minor.
Okay, that's good to know, Representative. So that was actually the earlier question of our colleague Saiki.
I have one question here for the two gentlemen. This is from Maria Rita Trillo. What can you suggest for the Philippines to have a more efficient and more timely vaccine rollout? Ambassador Kell, can you go first?
Wah, naku. Wah, talagang mahigpit ang tanong po ninyo. No, look, it's a great question. Look, I mean, as I mentioned before, each government, approaches this in its own way, and it's not really my place to comment. But what I can say is, from what I know, talking to your ministers, secretaries, and officials, is that they are doing their best to procure vaccines. The first step is to get vaccines, and then you can roll them out. And I do get the sense that they're working very hard to get vaccines. There is a global supply shortage. My understanding from talking to people in the government here is that it's been very difficult to procure, not because they don't want to, but they just can't get the access. And that will have an impact, therefore, on the rollout of your vaccination program here in the Philippines. But I think, people here know what needs to be done. The embassy is part of a private sector initiative to procure vaccines for our staff. I should add that in New Zealand, our government has taken the position that anyone who lives in New Zealand can get vaccinated, and that's just not New Zealanders. It's also, visitors, people who work in embassies of other governments based in New Zealand and their families. And so here we are also taking steps to secure a vaccine. And I have to say that, the experience has been professional. And I recognize that the Philippines is a very big place, and there are some areas where it's very difficult to get a vaccine too. But my sense is the people who are responsible are trying to do their best.
Thank you so much, Ambassador Kell. Representative Sue, can you help us with this question? Can you
Yes.
suggest for the Philippines to have a more efficient and more timely vaccine rollout? Do you have any suggestions?
Thank you for asking me this question. First of all, I would like to say the Philippine government has been doing its best to combat COVID-19. And just like Ambassador Kell mentioned, each country, they have different situation in securing the vaccine. To be honest, in the beginning, even for Taiwan, we had a problem in purchasing vaccine. And but we try every way to overcome this difficulty. That's why now we secure 20 million doses of vaccines. And I believe, to do the vaccination in the Philippines, you already have your priorities. Like frontline health workers, they are the first tier, and then the police and the armed forces people. Same thing in Taiwan, and the health workers, frontline health workers, and the police and the armed forces personnel, they are also the first priority to get inoculation. And I think it depends on how soon of the volumes of vaccine you can get from overseas. That's the case in the Philippines. In the meanwhile, I think adjustments will be made on a rolling basis, based on the development of the pandemic and also the supply of vaccine and the shipment and the administration of inoculation. That all matters. So I echo Ambassador Kell's saying, each country is facing different situation. So I believe in the Philippines, you already have a very good priority list for those people who should be inoculated. And now the problem is, how the government could secure enough vaccines, from overseas. Thank you.
Thank you, Representative Mike.
Excuse me, Anne. Can
Yes.
I just add a question? Just a point. I should make this point because it's not fair to your listeners if I don't make the point, and that is I haven't. Mike, Representative Michael has noted some of the challenges that their government has faced. I just wanted to say that we too, are facing a lot of challenges in our vaccination rollout. And I don't want to give the impression that everything is going swimmingly well in New Zealand, because this is the largest we've ever done. It's really difficult and it's very hard. And we too are coming up with all these problems we didn't anticipate and have to work with. And in that sense, I think all governments are in the same boat. Thank you.
Thank you, Ambassador Kell. Before Mike tackles more questions from the audience, I'd like to make more shout outs to Dennis Romeric, Gabriel Tuason, Markel Davad, Desiree Helm, Lorna Luis, Mai Sandico, Mag Santos, Shoni Giray, April Sarabia, Brix Villaruel, Sari Osorio, Lawrence Marasigan, and Roxanne Abalos. Mike, any more questions from the audience?
So far, with regard to vaccine rollout, we've pretty much covered them. Most of the questions probably we can reserve for the latter part of the discussions. Unless there's anything else from your end, Anne.
No, I'm okay. Unless more from the audience. I think they're very interesting questions to ask.
And actually, lot of comments coming here in our Facebook comments. Unless, hold on.
Can you mention a few so that our
All right.
guests can will be aware? Yeah,
I will just,
choose a few.
yes, coming from
Here.
toward the latter part. Okay. I will just read what's in the screen. People in Taiwan and New Zealand are easy to talk to. Government and the opposition help each other in addressing the COVID-19 situation. In the Philippines, Filipinos are kind of stubborn. That's
They're
the
marketing.
rough translation to it.
Like
The
really-
opposition actively questions each and every policy that is released by the government. That is why we have so many rules and levels of control. Kailangan ipaliwanag lahat para malinaw, or everything has to be explained for it or for them to be clear. And just scrolling some more relevant comments in our comment section. So from Monsi Serrano, agree with Ambassador Kell and Representative Su. Simplicity is beauty levels, or rather, simplicity is beauty. Levels 1 and 4, at least for New Zealand, and then levels 1 and 3 for Taiwan, would be better than adding those fancy, I guess, levels of classifications. Okay. We actually have a question here on vaccination by our boss, Boss Anton Cabangon. I hope that has already been addressed, sir, about the vaccine rollout and the population of both countries involved in their respective vaccinations. Okay, one question here from our colleague, Edwin Salian. Would you say it's more difficult to control the spread of COVID-19 in densely populated areas or countries? One such example is the Philippines compared to places with similar populations. Would our diplomats would like to chime in on that query from our audience?
Well, would you like me to start off, Rep Michael? Look, I think it's a great question, and it's one that often, because we're a small country, right? We're 5 million people, yet we're spread all over. I think, though, that the question probably, to understand the question is really around how are the countries organized to deal with a pandemic of this nature, and whether you're a small country with a population spread all over it, or whether you're a country which is densely populated, if your systems are geared for your characteristics, then you're okay. But if the systems can still be overwhelmed, whether you're small or not, I don't think actually matters. And so in our case, even though we're a very small population and we don't have many people living together in one place, we travel a lot. We're very mobile, which means you can spread the COVID virus quite easily. Not because you're next door to someone, but you travel to meet someone and then you go and meet someone else. And so I actually think the challenges are common in nature, but they present differently. Whether you're a small country with a sparsely populated profile, or a large country with dense populations. That would be my response.
Okay, I can have my response too. I quite agree with what Ambassador Kell just mentioned. I think it doesn't matter whether your country is densely populated or not. For example, Taiwan is the second, populated, or density of population is the second high in the world, second to the Netherlands. But our people are very disciplined. Wherever they go, they wear a mask. They try to keep social distancing. even in the mass transit system, the subway in Taiwan, everyone, once you are in any public place, you are so aware of protecting yourself and also protecting other people. So discipline is one important thing I think I would like to mention. And also, because of our people's awareness, the health awareness and the discipline and the solidarity among all the peoples, that's how we could achieve the containment of the COVID-19. In Taiwan, if you go to any place, first, your body temperature will be measured at a company, at a school, at a restaurant, and people also wash their hands quite often, and they also wash their hands with alcohol when they are in a public place. Even the restaurant, they have their health awareness. Nowadays, you go to a restaurant, they do the same thing like you see in the Philippines. They use the plastic, transparent plastic screen to separate each customer, try to protect the customers. So I think it doesn't matter is how your people has the awareness of protecting themselves and also protecting other people, and then to follow the protocols implemented by your government. Thank you.
All right. Before we go to another question, I would just like to ask both envoys. In your respective countries, are people required to wear? Well, out of curiosity, are they required to wear face shields like we do here in the Philippines?
Okay, I'll answer first because it's always Ambassador Kell. It's not fair to him. We are not required to wear face mask, to wear face shield.
Face shields.
No. In Taiwan, we only ask people to wear a face mask, but not wearing a face shield. So that's the case.
I see. So that says a lot about discipline in your among your countrymen representatives. So how about in New Zealand, Ambassador Kell? How is it?
So in New Zealand,
there's something like that there.
Yeah, look, we're not required to wear face masks in level 1. It's pretty much as normal. However, when I'm just trying to remember now because I haven't been to New Zealand for such a long time. If we have an alert, then there is a requirement to wear face masks on public transport. But anywhere else, no. And I've never heard of anyone wearing a face shield, so it's not a requirement.
Okay. So kudos to both the Kiwis and the Taiwanese. Okay, we have a question here from our comment section. Since this is from Mr. Paul Serap, I hope I was able to pronounce your surname correctly, sir. Since vaccination in New Zealand is not mandatory, I wonder what will happen for those who didn't get the shot. Didn't get the shot. Are they denied things like inability to travel, or then things like athletic events in a large crowd? I guess we could also ask the same from representatives too.
Yeah, look, thank you very much, Paul, for the question. No, it's a good one. I think it's fair to say that nothing has been decided yet, and that's partly because the science is not certain on whether just because you're vaccinated, does that prevent you from transmitting the virus. And so the way that New Zealand, anyway, is approaching this is that even if you've been vaccinated, you still have to observe all the public health protocols, social distancing, etc. And there's been no decisions taken yet on what does vaccination mean for travel or for attending certain large-scale events. I think those decisions will come when the science is clearer about how vaccination and virus transmission intersect.
Okay. How about in Taiwan? How is it in Taiwan, Representative Sue? I have a friend there, and I see her Instagram posts, and people there, they're enjoying their way of life still, despite the current spike in the cases, the COVID-19 cases.
Actually, vaccination in Taiwan is also not mandatory, but the government encourage people to get inoculation. And like I mentioned, our people are very disciplined and they are cooperative citizens. So we are going to see more and more people in Taiwan. They are going to the place to get the vaccination. And I think people now understand to achieve the goal of herd immunity is very important. For example, in Taiwan, if we want to achieve the herd immunity, uh, it means 65% of the entire population. It's almost 24 million people in Taiwan. Have to be inoculated. So it means at least 15 million people should get their jab. So the government is trying very hard to encourage people to get a vaccination, and people they do have the health awareness. So I'm quite sure, before the end of this year, we can achieve the goal of herd immunity in Taiwan. And that means, people could travel, freely. I mean, in Taiwan, we hope to see the border control of all the country in the world could be further relaxed, even travel bubble. And my colleague just reminded me that actually, in Taiwan, our alert level also categorized four. We have level 1, 2, 3, 4. I mentioned we have only level 3, but now we have a level 4. So that's my correction. Thank you very much.
Thank you, gentlemen. So really, discipline is key. Would you mind reading the other comment, Anne,
Yeah, I think
please?
we'll just have one last question from the audience. From Monsi A. Serrano. Do you think Ambassador Kell and Representative Su, our present administration's penchant for hiring ex-military generals has affected the COVID response in the Philippines compared to other neighbors? Can you react to that, Ambassador Kell? Do you think it has affected our COVID-19 response?
Okay, look, thank you very much for the question. And having lived here, I arrived in Manila 4 weeks before the lockdown. And so most of my experience here has been, traveling to work, going through checkpoints, seeing your armed forces in action and your police. Look, when I described our approach, I said that it was a whole of government, and the focus of my comment was on the health professional dimension. But the reality is, we too have used our defense force, quite a lot to help maintain border control, to help manage quarantine facilities. And I think the point is, if you consider, as a government, where do you find a large body of trained, disciplined people to help you in a crisis? Then clearly your defense forces, along with the other authorities, is a pool that you can draw on. And in New Zealand, we have definitely drawn on the defense forces to help in the COVID response at all levels. Whether it be at senior levels, providing advice to our task force, or people actually, being monitoring, managing quarantine facilities, supporting our immigration authorities, etc. So in that sense, it doesn't surprise me that a government like the one here would draw on that body of expertise and capability in a time when it's probably most needed. Ooh, lost you.
Okay, I think it's my turn. I would like to share with you. I would like to say, in Taiwan, people are so fortunate when the COVID-19 pandemic, outbreak, last year, then our Vice President, President Chen Jianren, he is a epidemiologist. So and then our commander, of the Central Epidemic Commander Center is our health minister. And so all the professionals working together. And in the meantime, like President Tsai mentioned, the fight against COVID-19 is not one person's task. It means not only the commander of the Central Epidemic Command Center. It's a fight, everyone should get involved. And that, really help our people, the awareness of working together with the government. So I think every country has its own unique situation and has its own consideration. And I do believe all the governments would like to see the mitigation of COVID-19 pandemic. What matters is the way they handle this situation. And I could see in the Philippines, now it's getting better and better. I mean, the coordination and the efforts, of the frontliners to mitigate the COVID-19 pandemic. Even, for Taiwan's case, people talk about the Taiwan success story, but actually, as countries worldwide have gained a better understanding of the issues concerning Taiwan's, international participation, Taiwan's bid to play a role in the World Health Assembly and the other World Health Organization activities, has won, overwhelming support. But very unfortunate, the WHO, the World Health Organization, and the related parties, they still set aside, this health issue. They only, consider political issue. And so we would like to urge that, the World Health Organization should set aside political considerations and acknowledge Taiwan's longstanding contributions to the international community in the areas of public health, disease prevention, and the human right to health. So we would like to see Taiwan could make more contribution to the world health security. In particular, we would like to see Taiwan could be invited to the 74th World Health Assembly to be held on May 24. It's pretty soon. So far, we haven't yet received an invitation. Taiwan's participation in the World Health Organization's meetings, activities, and mechanism means a lot to people around the world. I would like to say Taiwan can help, and Taiwan really would like to offer its help. Thank you.
Thank you very much, Representative Su. We are nearing the end of our discussion. I'd like to thank you very much, our envoys, for gracing our first coffee club for this year. As your closing remarks, may I ask you for the lessons that you learned from this experience? Let's start now with Representative Su. What are the lessons that you've learned?
Okay. In a word, I would like to say the lessons we learned is first, be always on alert when you are facing a pandemic. Even until this moment, people in Taiwan and the government are always on alert. Second, never relax until we achieve herd immunity. That's the two lessons I think we learned. And I also would like to say, we do think, like Ambassador Kell mentioned in the beginning, it's a global challenge, it's a global crisis. And all the countries in the world should try to work together to find a global solution, especially for the vaccine distribution. Like many countries in the world, they have the difficulty in securing the vaccine. So I would like to see all the countries working together. I would like to see the life of our people, of people in New Zealand, people in the Philippines, would get back to normal. And this COVID-19 pandemic has made so many people suffer from different kind of things, unemployment, even pass away. So I think what we learned is this pandemic has taught us working together as one. Thank you.
Thank you very much, Representative Su. Can I ask Ambassador Kell for your closing remarks on this, the lessons that you have learned?
Yeah, thank you very much, Anne. And look, I fully endorse what Representative Michael has said. I would probably just add on a few more. At the end of the day, we use a lot of big fancy words, hard sounding, science sounding, response, pandemic. But, at the heart of it all, it's people. And so it's that kind of people side of it too that, I think has come through very strongly in the way the world has tried to come together to manage this. And so if you talk about people, it's the simple stuff we all learn when we're very young. Be kind, be compassionate. Team approach works. It's the only way to get through a problem like this. Communicate, the importance of communicating. And then I suppose the last thing will be science. As Representative Michael has said, we need to be vigilant. And the way we do that is by employing science to inform us and guide us on when we need to act and how we act. So those would be the comments I would add. So thank you very much for this opportunity.
Thank you very much. Thank you very much, Ambassador Kell. Again, I'd like to thank you both for joining us in this coffee club. And hopefully we'll have another chance to talk to you again when the situation improves. And we hope that we will also be able to visit you in your own country. I'd like to thank Mike for joining me this morning. And yeah, do you have any last words to say?
Well, we've learned a lot from our diplomat guests. So just to probably promote my section, it's open for any updates of coming from their countries, not only with regard to their addressing the pandemic, but also the strengthening and bolstering of the bilateral relations between their countries and the Philippines. So a lot of good things have been said in today's coffee club, and we hope the interested and relevant sectors could learn from them, not only from our country, but probably those which are tuned, those others that are tuned into this coffee club session. So thank you, Anne, for this opportunity.
Again, thank you, and I hope to invite you on June 9 for our next coffee club, where we will be discussing education. The title for the next coffee club is Invest in Education. Learn to survive, survive to learn. Again, thank you, and good day to everyone. Thank you.
Thank you, Anne. Thank you, Michael. Thank you, Ambassador Kell.
Thank you, Anne. Thank you, Mike.
Thank you.
Thank you,
See you.
Representative Su.
Stay safe.
Thank you.
Have a great morning.
Thank you.
Bye. Thank you.
Bye-bye.